Welcome to another episode of Med Madness, where we delve into key topics that matter to your medical journey. Today, we're exploring a condition that affects many but is often misunderstood, social anxiety disorder, also known as social phobia. This episode will cover what social anxiety disorder is, its symptoms, how it's diagnosed, and the effective treatments available. We'll also discuss the subtype known as performance-only social anxiety disorder. By the end of this episode, you'll have a clear understanding of this condition and how it impacts those who live with it. Next, let's discuss what social anxiety disorder is. Social anxiety disorder is a condition characterized by a persistent fear of social or performance situations where one may be exposed to scrutiny by others. People with this disorder often worry about being judged, embarrassed, or humiliated in social settings. This fear can lead to significant distress and avoidance of these situations, which can impact a person's social, academic, and occupational functioning. The DSM-5 categorizes social anxiety disorder into two types, generalized and performance only. In the generalized form, individuals fear a wide range of social interactions. In contrast, those with the performance-only subtype experience anxiety only in situations where they need to perform, such as public speaking. This is crucial because it helps in tailoring the treatment approach. When diagnosing social anxiety disorder, healthcare professionals look for symptoms that have persisted for at least 6 months. The anxiety must be disproportionate to the actual threat posed by the social situation and must cause significant impairment in daily functioning. Next, let's explore the treatment options for social anxiety disorder. Treatment typically includes both pharmacological and non-pharmacological approaches. Selective serotonin reuptake inhibitors, or SSRIs, like sertraline, and serotonin norepinephrine reuptake inhibitors, or SNRIs, like venlafaxine, are commonly prescribed. These medications help to reduce symptoms by altering the balance of neurotransmitters in the brain. Cognitive behavioral therapy, or CBT, is also highly effective, focusing on changing the thought patterns that contribute to anxiety. For those with performance-only social anxiety disorder, treatment may include as-needed beta blockers like propranolol or benzodiazepines, such as lorazepam. However, benzodiazepines are generally avoided in individuals with a history of substance use disorder or when the performance situation requires full cognitive function, as they can cause sedation and cognitive impairment. Now let's consider a real-life scenario to better understand how this disorder manifests. Sarah, a 32-year-old marketing executive, has always been a bit nervous about public speaking. However, when she was promoted to a managerial position that required frequent presentations, her anxiety skyrocketed. Despite being confident in her skills, the thought of speaking in front of her team made her heart race and her hands tremble. She started avoiding presentations, and this began to affect her work performance. Sarah was diagnosed with performance-only social anxiety disorder. Her doctor prescribed propranolol to be taken before her presentations, which helped her manage the physical symptoms of anxiety, allowing her to perform confidently in her role. In conclusion, social anxiety disorder is more than just shyness. It's a condition that can severely impact one's quality of life. Whether it's generalized or performance only, understanding the symptoms and available treatments is crucial for managing the disorder effectively. Today, we've covered what social anxiety disorder is, how it's diagnosed, and the various treatment options available, including both medications and therapy. Before we wrap up, I encourage you to take part in our pre- and post-podcast quizzes to reinforce what you've learned today. And don't forget to review the Anki flashcards we've prepared for you. They're an excellent way to ensure you retain this important information. Thanks for tuning in to Med Madness, and as always, keep striving for excellence in your medical journey.